So chemokines or the proteins chemotactic agents help the neutrophils to go towards the microbes. But to do that, to reach those microbes and to do its function of killing, the neutrophils have to cross a lot of barriers. Okay, it has to cross the endothelium, it has to cross the basement membrane, it has to cross the muscle fibers and the matrix and all those cells in the matrix and everything. So to cross everything it needs help, right? So those help is provided by these chemokines. Now what are the examples of chemokines are? Leukotriene B4, LTB4, that is an arachidonic acid metabolite. Then the complement system components like C5a and C3a, some cytokines and some interleukins, particularly IL-8. Again, this is for your knowledge. You have to know what is a chemokine and some examples. That's it. Okay, this is an slide I guess I have put in your exam also, so we'll learn it. Okay, so what is this? This is a leukocyte, a neutrophil to be specific, right? Neutrophil is coming, it is trying to attach itself with the help of selectins. It is okay, I am not going to put up specific P selectin, E selectin. You just have to know that these are the selectins which are on the endothelial surface, which help the neutrophil to attach itself to the endothelial surface. Okay, so this is the selectins. Integrins are present on the neutrophil surface, you can see over here, right? Now this is the rolling phase where it has come on the endothelium and it is rolling. Can you see? It is rolling. Now then there is chemokines which are also helping it. This, it has, after rolling it has stick itself to the endothelium, that is called as adhesion phase. You see over here the adhesion phase. There was first rolling, it got tried, it tried to stick onto it, it is moving around and then it got stuck and then there were more connections formed and there it is in the stable adhesion phase. After getting adhesion it will try to come out from the gap, that is you can see over here, right? And the chemokines are guiding the path of the neutrophil. Can you see over here? These chemokines are guiding the neutrophil and where? Towards the bacteria. Okay, and you see over here it has crossed the endothelial layer, the basement membrane layer and out from it. And what is this? This is the extracellular matrix which is made up of fibrin and fibronectin. Okay, so the neutrophils which are supposed to stay inside the vessel has now come out and it is out to fight against the bacteria. Okay, this is just an example that a monocyte has ingested the microbes which we will study in phagocytosis. Okay, now phagocytosis. Phagocytosis is the process of engulfment of solid particulate material by the cells, and there are two main types, two cells which can do phagocytosis. That is neutrophils and macrophages. Those are the only two cells who do the phagocytosis. What do the phagocytic cells release? They generally release enzymes to kill the bacteria. Okay, so what are those enzymes? They are lysozyme, protease, collagenase, elastase, lipase, proteinase, gelatinase and acid hydrolysis. These are all those enzymes which end with ase. Okay, they are the generally the ones which destroy stuff. Okay, what are the phases of phagocytosis? There are three steps. First is recognition and attachment. The neutrophil or the monocyte has to first know how to recognize, okay, to recognize and to attach to that microbe. After recognizing and attaching to the microbe, it will engulf it, like eat it. So engulfment basically means swallowing it, kind of a thing. And after swallowing it and taking it in its belly, then it will undergo killing and degradation. Okay, you can see over here, this image is not that important, this image is important I guess. So this is the one which we are doing. The first one is recognition and attachment. Well, microbes bind to the receptors. You can see over here, these are the receptors. This is a microbe, it has bound to it. Second is engulfment, basically means um, gulping it down, like swallowing it. So engulfment, phagocyte membrane zips up around the microbe. So what happens is, here it got stuck, then it goes inside, and the other two layers kind of come up above it. Okay, and that is how it has formed a it has ingested the microbe inside it. After ingesting it, taking it inside in its cytoplasm, the lysosome will come and combine with it, because lysosome is the organelle, remember, present in the cell, that will come and join with this microbe and form a phagolysosome. Then that is how the lysosome will release the enzymes. Okay, this that's okay if you don't understand it, just know this, that the lysosomes will release the enzymes and kill the microbe and degrade it. Okay, this is it, degradation of microbes by lysosomal enzymes. Okay, that is a killing and degradation process. Now there are some people, not people, but some chemicals which help in the process of inflammation. They are called as the chemical mediators of inflammation, and this is just for the knowledge. So what do? They help, they mediate the process. Okay, they help that one after the other, all the steps start happening in the body. That thing is mediated by these chemicals. And what are the two types of mediators that are present in our body? They are either cell derived or they are plasma derived. Some mediators are also derived from the necrotic cells, we don't have to study that, but the two main types are either derived from the cell or they are derived from the plasma. Okay, the one derived from the cells are examples are histamine, serotonin, and prostaglandins, and etc. The one derived from the plasma are your complement systems, the coagulation cascades, the kinin system. Yes, all those stuff which I deleted from your curriculum. Yes, all those things, systems are the parts of your plasma mediators. Okay, chemical mediators from the plasma. Now where do the mediators from the cell, like which cells do these come from? So this is just for your information, that histamine comes from mast cells, basophils, platelets. Serotonin generally comes from platelets. Prostaglandins come from all the leukocytes, mast cells. They also release leukotrienes. They also release platelet activating factor. They also release reactive oxygen species. So all these are like mediators. Okay, they are helping in some way or the other way in the process of inflammation. Okay, that's it, that's just for your knowledge. Okay, and complement system, coagulation system, they are generally based on plasma derived, and plasma is formed with the help of liver. Okay, that's why they are showing liver over here, and this is the cell. This is again another just for your knowledge slide, do not panic, only just to tell you what are the processes in which the chemical mediators help. So they help in causing vasodilation, you remember, right? The first step, first there was constriction and immediately after that there was vasodilation, right? So that is mediated by this prostaglandin, nitric oxide, histamine, etc. Then there is the second step of increased vascular permeability, right? Remember, like in the vascular changes, so that is done by histamine and serotonin, C3, C5a, bradykinin, and etc. Then the next was cellular phase event like leukocyte recruitment and activation, that is done by this tumor necrosis factor, interleukin, chemokines, all these things. And these fever, pain, and tissue damage are the systemic reactions. Okay, what the body, which what happened because of the inflammatory process, then that is done by these chemokines. This is just for your knowledge to help you understand that why we need to know about the chemokines. Okay, how are they helping, what are the procedures that they are helping in. What are the outcomes of acute inflammation? Generally, the outcome of an acute inflammation will be either it will resolve, treat, completely, or it will resolve by a scar, there will be a scar, or if it is not able to resolve, it can move into chronic inflammation. Okay, So here shown a diagrammatic image. The injury has happened, the acute inflammation has happened, there has been vascular changes, there has been leukocyte recruitment, there have been mediators which are doing the process, everything has happened. Then either it can progress to chronic inflammation, or it can resolve completely, or it can cause a localized pus formation and then resolve, or it can, if the injury is not very big, it can undergo and it can start undergoing healing, fibrosis and healing immediately. Coming to the next, that is second, you can say phase, and you can also say the second type of inflammation. Okay, so sometimes some inflammation they move from acute to chronic phases. Sometimes some inflammations are chronic types directly, like tuberculosis infection, that generally comes in chronic inflammation directly. Okay, the inflammation of prolonged duration, weeks to months to years, in which active inflammation, tissue injury, and healing proceeds simultaneously. So everything is happening in chronic inflammation altogether. There is an inflammatory process going on, there is also injury going on, and there is also healing going on. So one side the body is trying to heal, the other side is bacteria is still working, and the other side body is still fighting, and everything is going on all together. It involves mainly following events. There is angiogenesis, mononuclear cell infiltrate. So when we said polymorphonuclear, that is like neutrophil, right? It has more lobes of the nucleus, whereas these are mononuclear, so only one nucleus. Macrophages, lymphocytes, plasma cells, and fibrosis. Third point is fibrosis. These are all the three events which are going on all together in chronic inflammation. What are the causes of chronic inflammation? It can either be followed by from an acute inflammation like pneumonia, or infection of the bone, osteomyelitis. Or it can be because there are very repeated attacks of acute inflammation. Repeatedly the kidney gets infected because of the urinary infection. Repeatedly the gallbladder gets infection because of a lot of fat ingestion, I guess. And chronic inflammation starting de novo, like I said, like mycobacterium tuberculosis, treponema pallidum, that causes syphilis. These infections come in the category of causing chronic inflammation. Okay, they don't cause an acute phase, they cause chronic inflammation directly. Now, what are the cells of chronic inflammation? Macrophages, lymphocytes, plasma cells. Eosinophils and mast cells come in both, okay, acute and chronic both, hence they are put here. So what I'm trying to say over here is, generally what happens is, when there is acute inflammation, neutrophils will come, fight, and then go away. But when there is and chronic inflammation, lymphocytes will come. But eosinophils and mast cells are the cells which will come during the acute phase, and they will stay even in the chronic phases. Okay, they do not go away, they stay. Now first cell that we are discussing is macrophage. Macrophage are the dominant cells of the chronic inflammation. They are derived from the circulating blood monocytes. So do we know what are the types of WBCs? Neutrophils, lymphocytes, eosinophils, basophils, and monocytes. Now monocytes can convert themselves or modify themselves and become macrophages. Okay, and every system of our body has a macrophage. Okay, so like liver has its own macrophage which is called as Kupffer cells. Then lymph nodes and spleen has their own macrophages which is called as sinus histiocyte. Our brain has its own macrophage which is called as microglial cell. The lungs has its own macrophage that is called as alveolar macrophage. Even our skin has its own macrophage which is called as Langerhans cells. So every system has its own macrophages. So macrophages are basically those who come and eat away the bad and unwanted things. Now lymphocytes are of two types. They are T and B, and they they generally, lymphocytes and macrophages occur like, they are like friends, so they generally work with each other. So if macrophage will come, it will call on lymphocyte also, and if lymphocyte will come, it will call on macrophage also, and they both work together kind of a way. So lymphocytes is fighting and macrophage is eating kind of thing. Okay, so phagocytosis and everything is done by macrophage, whereas killing the bacteria and everything is done by the killer lymphocytes. Now, what are the systemic effects of inflammation? Fever. Whenever there is inflammatory process going on in the body, our body will give a response of fever. There may be anemia. Why? Because inflammation, there is blood loss happening, and the other substances are not working properly, so there is an imbalance of plasma and red blood cells, and it causes anemia. Leukocytosis, because there is a increase in the WBCs, because you need more WBCs to fight against the infection, so leukocytosis. ESR, that is the erythrocyte sedimentation rate, is elevated. And amyloidosis is basically whenever body is fighting, and if it keeps on fighting on a very chronic level, there are proteins which get formed and they get deposited in the body. Those proteins are called as amyloidosis. Okay, we've done with the inflammation. The next phase that we are studying is wound healing. What is a wound? So wound is an injury which is caused by an external force, and it can involve any tissue, any organ, anything. How is wound classified? It is classified on the basis of where it has originated, how dirty is the wound, like contamination, and how deep is the wound. Okay, based on it, its healing is classified. Again, based on the origin, so either it can be because of a mechanical injury like puncturing, or cutting with a scissors, knife, or scalpel incision, or getting crushed in the road traffic accident, or getting torn, or getting bitten by an animal, or getting shot by a gun or something. Those are all mechanical wounds. It can be caused by some chemicals like some acids, bases. They can also cause injury. It can be caused by radiation also. It can be caused by thermal. Either you burn yourself, or you place your hands in very cold areas, then that can also cause wound. And sometimes toxins and venoms like snake bite and uh, bee bite and stuff like that can also cause wound. Okay, that was the one type of classification of wound. Second type is how dirty is the wound. Either it is a very clean wound, and clean wound is generally the scalpel cut in an operation theater is considered as a clean wound. A wound that is infected due to glass is considered as a clean wound. A clean and contaminated wound would be you are cutting your vegetables and the knife hits you. So the knife is, you were cutting the fruits and vegetables, so it is contaminated, and that knife has hit your skin. So the injury that it will cause is a clean and contaminated. The cut is clean, but it is contaminated because the knife was contaminated. Now, contaminated wound is generally seen in your most road traffic accidents, like in your if you're on a motorbike or something, and you get thrown on the road and gets crashed, then you have stones and stuff in the wound. That is definitely a contaminated wound. Okay, or getting bitten by a rabies infected dog, definitely contaminated wound, right? Because the bite will have the rabies virus in it. So the next classification is based on the depth. It can be superficial, only affecting the epidermis. It can affect your epidermis and dermis both, causing a partial thickness. If it affects epidermis, dermis, and even the subcutaneous fat, it's a full thickness wound. And you call a wound a deep wound only and only when you can see the muscle layer also. Okay, you can see the muscles and bones and all those serious accidents, and you see all those muscles and bones exposed. Those are called the deep wounds. Okay, healing is the body's response to injury in an attempt to restore normal structure and function. Okay, so it is the body's response. Inflammation was also a body's response, and it is followed by healing. So healing is also a body's response. Now there can be two types of processes. Either it can be a regeneration or it can be repairing. So how do I tell you the difference between both? Regeneration means simply it generates again, right? And repairing means, we have got torn jeans and you try to stitch it up, you will always see patches on the jeans, right? Because you can never make it like the original one. So that is repair work, you have put in something. And regeneration is when you are stitching up your cotton fabric clothes. So if you have stitched them up, you don't really see much damage because that's a thin cloth and you don't really see much. Anyways, that's regeneration. So regeneration is when healing takes place by proliferation of parenchymal cells and usually results in complete restoration of the original tissue. So it will look exactly like it was, okay, like absolutely normal. So there is a proper structure maintained, everything. Where repair is, there is a proliferation of the connective tissue elements resulting in fibrosis and scarring, some patchwork scene. There are two processes happening in repair. There is a granulation tissue formation and then there is a contraction of the wound. So cells involved in the process of repair are, so many cells are involved. There is mesenchymal, endothelial, macrophages, platelets, parenchymal cells. Everything starts working together. Now what are the phases for granulation tissue? So what is granulation tissue? Is basically whenever you have an injury which is big, when you can see. So first of all, there will be an inflammation going on. There will be blood clots at the place. There will be inflammatory cells coming out. They will kill the microbes and the dirt and everything. And if your wound, you have cleaned it and disinfected it properly, then it undergoes the phase of clearance, where all the neutrophils and enzymes and all the dead particles and everything will go away from the wound. That is, why do you have to undergo dressing of your wounds? So because as it is healing, you have to remove the dead material, right? That's why you need to dress your wounds. So every time you dress your wound, you remove the bandage and you check. If it is yellow, you still have to wait. It is going to take time. But if it has become red, that means that now the healing process is going to start. So when your bandage has become red, you see, and the surface of the wound is also red, it is not yellowish, that means the red surface is the granulation tissue. And granulation tissue generally has two things in it. It is red because there are so many vessels, new vessels which have formed there, and the new vessels have also helped in developing the fibrosis, okay, because fibrous cells require blood and nutrients to grow, right? So there is new blood vessels forming in the place and there is fibrosis happening. Now what is angiogenesis? Angiogenesis means same thing as neovascularization, and it means formation of new blood vessels, okay. You will see this term in neoplasia also, okay. It basically means forming new blood vessels, and whenever new blood vessels are formed means new cells are getting formed, okay. So that is angiogenesis, formation of new blood vessels at the site of injury by takes place by the proliferation of endothelial cells from the margins of severe blood vessels. So newly formed blood vessels are more leaky, accounting for the more edematous appearance of new granulation tissue. So granulation tissue looks red because of more new blood vessels, and it looks edematous because the fluids are coming out, because the vessels are new, they are not that not that intelligent. Soon these blood vessels differentiate into the muscular arterioles, thin walled venules and true capillaries. So after they differentiate, then they become proper, okay, then that is they have matured. So now the wound is healing properly, and granulation tissue will start getting covered with fibrosis, and then it will start getting covered with epidermis, and the normal skin will start coming back, okay. Now angiogenesis, new blood vessels get formed under the influence of what? Growth factors. So vascular endothelial growth factor, platelet derived growth factor, transforming growth factor and fibroblast growth factor. This is just to make you realize what are the growth factors which help in the formation of new blood vessels. Do not panic, okay? Fibrogenesis. The newly formed blood vessels are present in an amorphous ground substance. The new fibroblasts originate from fibrocytes. Okay, so what they are trying to say over here is one side there are new vessels getting formed, and the other side the fibrous tissue is getting proliferated. More new fibrocytes, new fibrous cells are forming, because fibrous cells are going to make up the matrix, and they are going to lay the, the bases, and those fibrous cells will then start contracting. That is the wound contraction. And when the wound starts contracting, it will start, the two surfaces will start coming near each other, and so it can heal properly, because whenever you have a tear, you need to bring the two edges together. But to bring the two edges together, you need something, right? So when we are, like for example, when we are stitching, so the thread, our needle and thread, is trying to bring the two edges together, right? Same way here, the fibrous tissue is trying to bring the two edges together in a wound. Now what is this? um, as the collagen fibers, which are formed as a result of fibrogenesis, when they start getting accumulated, they result in the formation of an inactive looking scar. So a scar like is there, and that scar is called as cicatrization. Don't worry, I have not asked about it, just to familiarize yourself with the term. Sometimes they use this term. When the doctor or the surgeon uses this term, it is generally to say that the wound has healed, but not completely. It still needs to heal properly. Okay, it is an incomplete healing. This is just a picture to show you. As you can see over here, the granulation tissue is reddish. Okay, here it is a bright yellowish, it will become more reddish, and then you can see. So when it becomes, the fibrous tissue starts coming, when the fibrous tissue will start coming, these two edges will start pulling near each other, so that the healing can take place, or repair can take place, right? Contraction of wound. The wound starts contracting after 2 to 3 days, which is completed by the 14th day, and it helps in rapid healing. Now you know why it has to contract, right? You can see here, to bring the two edges together, it has to contract. And the factors which are responsible are dehydration, the contraction of the collagen, and new formation of new myofibroblast. Now what are the types of wound healing? There are two types: primary and secondary. Primary is generally seen when there is a clean, uninfected wound, a surgically incised wound, there is not much loss of the tissue, and when generally when there is surgical sutures. Secondary is seen when there is very large tissue defects, okay, and there is a lot of loss of tissues, and you cannot bring the two surfaces together. So you can see over here, this was a small cut, so it got healed, and nothing is left behind, so that is primary. This one was a very big injury, and it had to be removed, but still some space stays behind, so that will cause lot of fibrosis over here, and that will result in a scar like formation. So that is a secondary intention healing. What are the difference? Primary healing is generally clean, secondary is not clean. Infection is, there is no infection in the primary, in the secondary it is infected. Margins in primary are surgically clean, in secondary it is irregular. Here sutures are used, secondary sutures are not used. There is a small granulation tissue in primary, there is a large granulation tissue in secondary. Here there is a very linear, a very tiny scar, hardly visible. Here it is an irregular wound like surface. Complications are not very frequent with the primary, whereas in the secondary healing, complications are very frequent. What are the factors which affect the wound healing? Infection. If there is any infection at the local site, of course the wound healing is going to be delayed. If the location of the wound is at a place where it keeps on getting infected again and again, right? Immobilization, you need the wound to contract and everything, you have to immobilize it, okay? It has to stay stable, right? If you keep on moving the wound, it is not going to heal properly, so that will also not help in healing. Physical factors, like there is already a injured site, and you again put some hot surface on it, or you pour some chemical on it, and then these are the local factors, okay? Now systemic factors are nutritional factors. If you don't eat properly, like you need vitamin C to form collagen, right? But if you are not eating vitamin C, your collagen is not going to form, so your wound healing is not going to be natural. Age of the patient: in old age, the elastin tissue, the collagen tissue is not so good. Systemic infection, there is infection which is affecting the whole body like pneumonia or something. Administration of glucocorticoids, so steroids are getting injected, not good.